Hi, everybody, and welcome to our August edition of the Excellence Through Quality Improvement Project's webinar series. And today we're looking at something that's probably top of mind to most, and that's Ontario health teams and community mental health and addictions. And we're posing the question to you, and maybe we're going to talk a little bit about, are you ready? So we're really happy to be here, and thank you for joining us. And we've got some exciting material lined up to really explore this topic in great detail. First of all, by way of logistics, if you're new to using GoToWebinar, there's a control panel that has all the various functions on it. You'll notice that there's a drop-down for handouts. So if you click that little drop-down, you'll find a PDF copy of today's presentation on there for you that you can download and keep. We would also ask that on the drop-down that says questions, you use that and type in your questions throughout the presentation. And we're going to save all those questions up till the end, and we'll then pose those back to our panel to respond. If you're having any trouble, also any technical issues or any trouble hearing or seeing the content, please let us know in the chat box, which is on that menu as well, and we'll do our best on our end to try and rectify that for you. We'd also ask that on the chat box right now, if you could just take a second and type in how many folks are at your site watching this webinar with you today. That helps us just to get a sense of how many people we have participating today. We will also go through at the end of this webinar some resources and some additional material and some links that will hopefully be a follow-up to this content for you today. And we'll also share the recording of this webinar. So all of the E-QIP webinars that we do, we post them both on our community of practice, which is housed on the HQO Quorum platform. And you're welcome to come and join us there for all things E-QIP and quality improvement. But we also have a YouTube channel, so we'll make sure that we post this webinar on there so you can rewatch it, share it with your friends, all that kind of fun stuff. So the objectives for today are really fourfold, and we're really, again, going to hopefully engage participants in some conversation at the end, and we'll be looking for your questions and your input into this webinar. But our objectives today is number one, to provide an update on the evolution of Ontario health teams and the implications for the mental health and addiction sector. Secondly, we're going to describe the importance of performance measurement and continuous quality improvement within our sector. Thirdly, we're going to define quality improvement and data culture and how they lend to the Quadruple Aim. And we've been hearing a lot about that Quadruple Aim, I think, within the healthcare transformation. And that's something that originates really in the quality improvement realm. So we'll talk a lot about that. And then lastly, we're going to share some applicable resources to help advance your organization's QI readiness and data culture. And we've got lots of exciting stuff planned for you. So without further ado, I'll introduce the panelists today and then hand it over to Lynette Katsiva, who is our first guest speaker. So my name is Michael Dunn. I'm Director of Quality Improvement here at CMHA Ontario and co-lead of the Excellence Through Quality Improvement Project. And I'll be acting as a bit of an MC today and delivering a little bit of the content towards the end. Joined by my partner in all things quality improvement, Debbie Bang, Director of Quality Improvement at Addictions and Mental Health Ontario. And then our two distinguished panelists are Michael Scarpitti, who's a policy analyst here at CMHA Ontario and really has his finger on the pulse of the healthcare transformation, and Lynette Katsiva, who's the Manager of Policy and Research at Addictions and Mental Health Ontario, who's extremely experienced in the area of transformation and policy and is going to share her insights with us as well. So without further ado, I'm going to hand it over to Lynette, who's going to take us through the restructuring of healthcare delivery in Ontario.
Okay. Thanks very much for that introduction, Michael. I'm very excited to be here. So as Michael said, my name is Lynette Katsiva, and I'm the Manager of Policy and Research at AMHO. And I will mostly be speaking today to the restructuring of healthcare delivery in Ontario, giving a bit of a context, or setting up the context of background in terms of things that have happened. and probably a lot of us are quite familiar with this since we've been living it. So I won't spend too much time on it, but if you do have any questions or need me to go through anything again, please just let me know. Okay. Okay, thank you, technology. So first slide, speaking to the current changes that have happened since last year. So as we know, since their election the last year, the provincial government has been very clear about their focus on restructuring the healthcare system. So as one of their first steps, in order to figure out what needed to change, or what changes that the government needed to make, they had Ernst & Young to conduct a line-by-line review on past government spending. And they released their report in September of last year, I believe, outlining their findings, which included a number of recommendations for government, so such as government needing to modernize services through digital and shared service models, government needing to find cost efficiencies, redirecting funding to where it mattered most, and maximizing their assets in order to improve productivity. We have details. If you want further details in terms of what was in that report, we have a link to it up here on the slide deck. So based on that, on those findings, one of the things that government did was to create a Premier's Council that we're all familiar with, and it was a Premier's Council on improving healthcare and ending hallway medicine. And this council was tasked with providing strategic priorities and actions, and really that the point of all this was to come up with recommendations that would lead to improved health and wellness outcomes for all Ontarians, that would result in higher patient satisfaction, more efficient use of taxpayer dollars, and result in lower wait times across the province. And these priorities or these recommendations would then go to the Premier and the Deputy Premier, as well as the Minister of Health and Long-Term Care. So Dr. Ruben Devlin was appointed as the special advisor leading this council and has been doing so since. And since the creation of this council, they've released 2 reports so far. The first one identified key challenges contributing to hallway healthcare and themes that could potentially address these challenges. And the next one really began to start looking at recommendations around what we need to do to address some of these challenges. So the next slide speaks to the working groups that, or subcommittees that are part of this council, and they include the acute care, primary care, long-term care, home and community care, mental health and addictions, and digital health care. So all these committees, the work that they've been doing and their recommendations have gone up to the council, and their input has supported some of the recommendations that have come out in the reports that have been produced by this council. So that's one of the changes that happened. Another significant recent change that has taken place was the cabinet shuffle that happened in mid-June that saw the reorganizations of a number of ministries, including the Ministry of Health. So the changes that happened here was that Minister Christine Elliott, well, that wasn't a change, but she was reappointed the Minister of Health. A new Minister of Long-Term Care was appointed, Minister Mary Lee Fullerton, and of significance to the mental health and addiction sector was the addition of a new Associate Minister of Mental Health and Addiction, Minister Michael Tibolo, who was appointed. So we'll wait to see what these changes mean for the sector, but I think it's good to see a bit of that focus being placed around mental health and addictions. Now, the next few slides will speak to the legislation that saw the creation of Ontario Health and the Ontario Health Teams, or OHTs, as they're being referred to nowadays, which by now most of you are familiar with. So I'll breeze through these next slides, but like I said, if you have any questions, please let us know. So as we know, on April 18th, the People's Healthcare Act received royal assent, bringing into law the Connecting Care Act, which is the legislation that will be used to govern the new healthcare system. This act also amends the Ministry of Health and Long-Term Care Act to create an Indigenous Health Council and French Language Health Services Advisory Council. So this previously existed through regulation. So in terms of key reforms or key features of this reform, A significant one, I would say, was, and most would say, was that this new act created a central agency called Ontario Health that would replace, as we know, 20 organizations, including the LHINs, Health Quality Ontario, Cancer Care Ontario, eHealth Ontario, among others. In fact, as we know, so these organizations would be replaced by Ontario Health, and as we know right now, most of their boards of these organizations no longer exist or have been dissolved, and they now report to Ontario Health. Another feature of this was the creation of Ontario Health teams called Integrated Care Delivery Systems that would include health service providers that would now receive their funding from Ontario Health. From what we know is at the end of this, it's expected that there'll be about 50 to 80, that number seems to have changed in between, but I would say 80 Ontario Health teams at the end of this process. So Ontario Health is expected to act as a single point of accountability. So really what that means, they'll be responsible for performance management and outcome measurement for healthcare providers, and they'll also be required to provide support for healthcare providers to better use digital tools to support continuity of care and improve patient experience. There's also an updated supply chain management that was included in this. Another important point to note is that Ontario Health would also have powers to integrate, and this is similar to those powers that were found in the LHIN Act, but this is something that also showed up here as well. In terms of governance, so the Ontario Health Board is in place and has been in place since March, and is currently chaired by Bill Hatanaka and has 15 other members in addition to this, 15 members in total sitting on the board. The board will be appointed by orders of council, and it's expected they'll serve will serve 3-year terms and will be able to serve a maximum of 6 years. Again, if you need additional information in terms of who's sitting on this board, what their roles are, or what their previous roles are or experience, please follow this link that's available on the website, on the slide, sorry. In terms of leadership right now, currently Susan Fitzpatrick, who was previously the CEO of Toronto Central LHIN, sorry about that, and was also previously an Associate Deputy Minister at the Ministry of Health and Long-Term Care, is currently the interim CEO of Ontario Health. But what we know right now is that Ontario Health is currently in the process of recruiting a permanent CEO, so we still don't have an idea of who that person will be, but probably should find out by the end of the year. So recent announcements have shown that really one of the focuses for Ontario Health will be on mental health and addictions, which is great. At the end of May, the government introduced the Foundations for Promoting and Protecting Mental Health and Addiction Services Act. And with this act, part of it came the commitment to create a mental health and addiction center of excellence within Ontario Health. Now, this center would now become a central point of accountability and oversight for mental health and addictions care. They'd be responsible for standardizing and monitoring the quality and delivery of services and clinical care across the province. They would be responsible for providing support and any resources needed to Ontario Health teams, as well as performing any other functions that the minister may direct for them. So I think that's great, and I believe they're just getting started in terms of their work, so waiting to see exactly what that would mean. So in terms of Ontario Health teams, we know since the announcement happened, a lot of things have been happening, and this process has been moving quite quickly in terms of determining who those initial early adopters, as they call them, will be. So we know that the OHTs are currently being implemented, and their objective is, of course, to provide seamless coordinated care through a team of networked providers. So a lot of providers, possibly a lot of you on the phone call, have been part of discussions where you either submitted applications that were due last month, I believe that was, and other organizations are still in the process of having discussions to go forward. So it's well underway, and like we said earlier on, it's expected that at the end of this whole process, there should be about 80 of them in total. So this is just a reminder in terms of the services that would need to be included as part of Ontario Health Teams. So a minimum of 3 of these services listed here would need to be a part of it. And those are the hospital services, primary care, mental health or addictions, home care, community services, long-term care, palliative care, and any other prescribed healthcare services or non-health services as listed here. So as a reminder, those are the 3 minimum requirements that would need to be included as part of an Ontario Health Team. So as we said, the deadline to submit the initial applications was May the 9th. And from what we had from the ministry, they received about 150 applications. Now, based on a third-party review, organizations that submitted applications were then placed in 3 categories. And this was to signify the stages of readiness that these organizations were at. So there were those who were put into the category of being in discovery, in development, and then some were invited to submit full applications. What we know right now is that 31 teams were invited to submit full applications. 41 teams were deemed in development and working towards a full application. And this is not on the list, but 9 teams were considered innovative models, and the rest of the providers or teams that put in applications were put into the in discovery category. And based off of that, so we now have a few upcoming deadlines that that is related to these application process. The ones that were invited to submit full applications have until the October the 9th, when they would need to submit their full applications, with teams being announced later on in the fall, and a second round deadline for self-assessments due early December. So quite a bit of work, quite a bit of movement since the announcement, quite a bit of things that have happened with this process. So as we can see, it's moving along quite quickly. So on this last slide that I'll speak to just outlines the number of resources that have been released by the ministry to support providers, because I guess they recognize that this process has been going on quite quickly and a lot of people need support. There's actually been, so the list is available on this slide for you to access if you need. There have actually been some recent webinars that have been taking place this week. Most recent one was yesterday, where the ministry just provided a quick update on the process, but they walked through the central program of support that they've developed to support providers or teams through this. They'll also be hosting 6 regional meetings across the province to support providers who are in various stages. So those going towards full application, in development, or in discovery. And there's actually the first meeting taking place tomorrow. Details on these meetings are available on the Rapid Improvement Support and Exchange website. If you don't know the address to that, please let us know and we'll share it with you. But it's one of the links that's on this list that has details on all of on those meetings that will be happening with regards to the application process. So that's it for me. Thank you very much. I will pass it on now to my colleague Michael to take you through the rest of the part.
Thanks so much for that, Lynette, and thank you for that overview of the system level changes in terms of Ontario Health and then Ontario Health Teams as well. Just want to take us through some potential implications. What does this all mean for the mental health and addictions sector as a whole, and how might this be changing how we interact with our partners moving forward? So I think first and foremost, it's just really important to, again, highlight, the importance of a mental health and addiction strategy across the province. And this is coming. Consultations are currently underway province-wide in terms of getting feedback on the strategy, the planned strategy, and things to consider moving forward. It's expected that the mental health and addiction strategy will be announced in 2019. And there are 6 core pillars to this strategy. And you'll see them on the slide. I really want to highlight, I think, especially relevant to this group and in the context of this webinar, data and quality improvement as two key pillars to this strategy and really important pieces in terms of moving care in the sector forward. You'll all remember that, not too long ago, last year, we heard about this $3.8 billion investment in mental health and addictions over the next 10 years. This really is demonstrating the provincial government's commitment to mental health and addiction services and how it's a central part of healthcare. We did see $174 million in the 2019-2020 budget, of course, and specifically kind of this focus on supportive housing, justice services, and many of the other kinds of specialized supports we provide in community, which is great. And I think it's important to note that there is this focus on equity. So services are expected, and this was outlined in the budget, to target priority populations specifically. This includes Indigenous populations, but also our Francophone community in Ontario. So here's our nice visual for those 6 pillars that I mentioned. As you can see, all interlinked and coming together to form the provincial strategy. But what's really important, again, is are kind of the foundational pieces. So data and quality improvement. We need data in order to see what's happening in our sector and across the system and plan for Ontario health teams. And then, of course, that links right into quality improvement and that we can use our data to make evidence-informed decisions and push the quality of care forward. So that's kind of the mental health lens. I think the next space we can dive into is what does this mean for community-based care specifically? Because it is important to note that there are these different kind of subsectors of care within mental health and addictions, and we have more acute-focused care alongside community. So for community specifically, I think it's important to note that there are special services that are offered in community, and it's important to recognize these strengths when agencies are going into their Ontario Health Team discussions. So really, community is an important part of the Ontario Health Team discussion, and community agencies can and are being leaders across the province when it comes to Ontario Health Teams. Our partnerships are our strength, so we have excellent partnerships across different sectors in community, whether it be primary care, long-term care, home care, and others, which really allow for a head start on this network-based approach to care. And I think it's important to note that there is a strong kind of partnership at the association level across the province. So Community Health Ontario is a very strong voice for community, working closely with the Ministry and Ontario Health on providing that community lens to these discussions. And you'll note that Community Health Ontario is a partnership between Addictions and Mental Health Ontario, Children's Mental Health Ontario, the Ontario Community Support Association, Canadian Mental Health Association Ontario Division, the Alliance for Healthier Communities, and Advantage Ontario. And this really speaks to that cross-sector collaboration. So it's not only happening on the ground in the form of Ontario Health Teams, but also at the association level. I think just thinking about health system reform and some of the opportunities that are, can be highlighted by community partners to focus on in these Ontario Health Team discussions. So I think the first one is very clear, is that community really thinks about healthcare in more of a biopsychosocial model rather than the traditional model. So greater focus on kind of a wider variety of social supports and healthcare supports. There's also this upstream focus, so there's a lot of expertise in social determinants of health that exists in the community. We try to take a social determinants lens to our policy making, but also to care delivery. And this really helps, keep people out of the hospital, which is a core mandate of this government. We also have lifespan services, so we have, heard mention of partners in the children's mental health space. We have services that are really delivered across the life course, which is an important piece. And of course, we have highly specialized services that focus on justice diversion, harm reduction, and supportive housing, which are really only found in community. So as leaders in community-based care, we offer real option and value add when it comes to ending hallway health care. And this comes kind of in 2 key areas. So the first is preventing kind of emergency department
visits where clients are better serviced in the community. So that's an input factor that can help alleviate hallway healthcare. The second is that output or discharge factor, and that's helping ALC patients, alternative level of care patients, again, who are better serviced outside of hospital, get back into the community and back to where they need to be. I think certainly from this government's perspective, efficiency and cost effectiveness are important pillars, and those are things you can also highlight in your discussions. Community-based care for specific populations is higher quality care, and it's also less expensive care and more cost-effective care. Especially for those ALC patients who should be outside of hospital. I think finally it's important to just set mental health back in kind of the broader healthcare landscape. So just keeping that confidence and going into Ontario Health Team discussions. This government has shown immense support for mental health and addictions as a whole, and that really speaks to the piece that mental health is health when we think about the sector moving forward. Just finally want to do a quick transition into kind of what this means for quality and quality improvement specifically, and certainly my colleagues will be speaking more to that for the duration of the webinar. But I just wanted to highlight the fact that Ontario Health Teams will be clinically and fiscally responsible for outcomes, and quality indicators are an important piece of this. And I just wanted to highlight this list of indicators or metrics that have been identified in the full application form for Ontario Health Teams. And you'll see things like ALC rate in there, which obviously relates to mental health and community specifically, frequency of ED use for mental health and addictions, which is on that list as well. And you'll also see things like wait time for community-based services. So there is the recognition that there are these standards and indicators that teams are being evaluated on, and specifically that mental health and community are recognized and represented in these standards. So I'll leave you with kind of two key, I think, takeaways from this discussion and things to think about moving forward when it comes to quality and data, specifically in Ontario Health Team discussions. So the first is, keep advocating for a data strategy. Keep stressing in your conversations the importance of high quality data collection in community mental health and addictions, just because this is going to be critical not only to mental health and addictions agencies, but to Ontario Health Teams. Partners are going to want to know what the right care mix is for the communities, and data is an important piece of that. Finally, leveraging the strengths of community-based care, specifically around quality and innovative programs such as case management and many others, and the cost effectiveness of care provided in the community. This is another key value add that community brings to Ontario Health Teams. And with that, I would like to pass it off to the next section.
Great, thanks, Michael, and thanks, Lynette. It's Mike Dunn here again. I'm going to go through fairly briefly with my colleague Debbie, just maybe a bit of a step back in thinking about quality improvement and performance measurement and data culture, because that's, as Michael and Lynette shared, that's really key to the rolling out of this health system transformation. We know that there's an important aspect of this that really is quality and data focused. And now, if we think about quality improvement as a bit of a starting point, I think it's important to reflect on this, because you can sometimes, with big transformations like this, become mired in all the concerns of things like governance and restructuring and what is it going to mean. But we really, I think, the objective of this transformation is to provide better, more high quality care to clients and patients. So if we look at things through that lens, it really brings us to quality improvement, and that's really our focus in E-QIP. And when we think about quality improvement, it's really taking a systematic approach, no matter what your role is within this system, to try and strive to enhance the quality, the impact, the positive impact of our service to the clients and families who put their trust in us. So, whether you're working frontline or whether you're working at a system level, it's about looking for those opportunities to try and make things work just a little bit better and provide care that's just a little bit higher quality for clients and families. And it's really an unrelenting process. Now, Michael mentioned a little bit about performance measurement and some potential indicators. And it's important to think about that in relationship to quality improvement as well, given that this really is foundational to this transformation. So when we think about performance measurement, we're really looking at the degree to which services achieve their desired outcomes, or local health systems achieve their desired outcomes. And we see these Ontario health teams that will hopefully be coming together. They're going to have some very concrete performance measures that they're hoping to achieve, and we want to be keeping our eye and measuring that effectively to know if we're achieving that goal. And so that data can really be collected and analyzed and used for the purposes of quality improvement. If we have a strong understanding of the effectiveness, the efficiency, the impact of this transformation and the services that we're providing, we then want to make sure that we're continuously trying to look for those opportunities to improve. And that performance measurement, of course, can be used for other things as well. In addition to quality improvement, things like accountability agreements, funding structures, all of that stuff that we're probably all very familiar with already. So performance monitoring is all about identifying the gaps between the current state and the desired performance that we're trying to achieve. And that can really become the jumping off point for making improvements. And we can begin to start benchmarking, setting standards and trying to meet and then hopefully exceed those standards. So quality improvement is really about, at least the way I think of it, it's really the nature of being curious and being aspirational. So being curious about what the data is telling us about the effectiveness of our services and trying to aspire to be even better. So with this transformation, as with all of our work, there's going to be ongoing performance measurement, and we want to be, and I think it's expected. I know anybody who's worked on an OHT application is well aware of the focus on quality improvement. We want to have structures in place and mechanisms in place to take that data and use it to improve as a local health system. And that's going to be a big expectation moving forward. So you've also likely seen and heard about the Quadruple Aim. Again, that's been at the forefront of some of the recent media releases and documents surrounding this change in our system. But it really becomes the compass north that we're setting ourselves to, the end goal that we all want to achieve if you work in this sector, and that is improving the client outcomes. So if people are putting their trust in us, they're coming with effective outcomes that ultimately we're improving the overall health of our communities. We're trying to do this work at the most efficient cost possible. I mean, we all know that that's a big concern. We don't have money growing on trees, especially in mental health and addictions care. And we're also trying to do that in a way that improves the provider experience and it's supporting our providers in this difficult work. So that's the Quadruple Aim that we're trying to achieve, and that originates in the quality improvement sphere, but it's been encouraging to hear from this government that that's going to be at the forefront of this transformation as well. And so to try and improve and try and reach that Quadruple Aim that we've set, we have those domains of quality. So providing safe care, being client-centered, effective, equitable, efficient, and timely, really those mechanisms that will help us to provide that high-quality care. And again, this is going to be part of this health system transformation, and as OHTs roll out, to have likely shared metrics and shared improvement goals relative to those domains of quality. So you'll start to see that if you haven't already in your local communities as you come together with your partners, where it is that you may want to target some of those quality improvement efforts. And so the toolbox to help make those improvements is really that model for improvement. Very practical, but very effective tools to help ask 3 questions in a PDSA cycle. So what are we trying to accomplish at the end of the day? How will we know that the change is an improvement? So that speaks to that measurement aspect, having metrics that tell us if the changes we're making or the new partnerships that we're making, whatever it be, are actually leading to an improvement. Thirdly, what changes can we make that will result in an improvement? And then testing those out sequentially using play-induced study act cycles. So that's really the melding of 3 very important models that fit together. So as I mentioned, the Quadruple Aim has really been at the forefront of the conversations around OHT, and this comes from the Ontario Health Team Guidance for Healthcare Providers and Organizations document, which was released earlier this year, and it speaks to what the Quadruple Aim looks like, sort of practically related to an OHT model. So you'll see better patient and caregiver experience, the desired outcomes equate to people get access to the care that they need when they need it. That's the desired outcome for this system. Also, people know how to navigate the system to meet their care needs. When we start talking about better patient population health outcomes, we're really looking at outcomes related to effective and appropriate care that's provided to patients. Health-related quality of life is improved. When we talk about better value and efficiency, that outcome really looks like the use of system resources is optimized. And again, that's been a big focus of this OHT work, to try and make sure that we have efficient pathways for client care. And then lastly, better provider experience really looks and feels like an outcome of providers have high levels of confidence in the system and provider health is supported. So very concretely, this is what this new model is looking to achieve. These are the outcomes that are looking to achieve. And you know, we can expect that there's going to be performance and quality measures attached to each of these. So this is sort of how, I'm a very visual person, this is sort of how I think of quality improvement in this current landscape. And this is a photo from a trek I did a few years ago. And so you can kind of see off in the distance, and maybe you can't on your screen, but through those mountains and valleys, there's a desired place that we want to get to. It's that end state. It's really about that quadruple aim, that integrated system, that effective system that's really centered around patients and clients and helping them to get through this system and get their needs met. That's where we ultimately want to get to, but the journey to get there is a little bit rocky and windy. It's not always going to be easy, but that path is really the path of quality improvement in data. So being able to effectively capture and interpret how our system is working and use that data to inform how we go forward at improving that system continuously. And that, I think, is really going to be foundational to all the work that we're doing together. I'm now going to just hand it over to my partner, Debbie Bang, who's going to talk a little bit about data culture and the importance of that.
Thanks, Mike, and thank you, Michael and Lynette, as well, for a very informative piece around OHTs and where we're heading. Part of what we wanted to talk about today is the difference between quality improvement and performance measurement, and then also to spend a little bit of time talking about data culture and what that looks and feels like at your organizational level. So there's essentially 3 fundamental elements that sort of help us to measure ourselves against whether or not we have a data culture that's going to be helpful in getting us to be doing quality improvement and performance measurement. And part of that is our mindset. So are we aligned with the Quadruple Aim that Mike has spent some time explaining to us, as well as the domains of quality? Do we have the skill set? So are our staff data literate? And what we're meaning by that is very basically, can they read and write and communicate in data? Do they think about data? Do they think about outcomes when they're talking about their intentions or what it is they would like to do or the changes they'd like to make in the program to better serve our clients? And then the tool set and the technology to support the data culture. And this becomes a little more challenging in our community mental health and addiction sector, and why Michael S. suggested that we continue to advocate for that data strategy to help us all be on a similar system, collecting the same sort of data, being able to describe apples and apples, and to have a system that feeds back the information that we need in a timely way to be able to do quality improvement. So the next slide. So there's sort of 4 Ps, and in the Excellence for Quality Improvement Project, E-QIP, we love short forms and little acronyms for things. So the 4 Ps of data culture and infrastructure are around policy, practice, product, and people. And so you can see here, the policy is about our management structures and how we communicate and talk about data and outcomes. And is it a part of our strategic direction for our organization? How do we make decisions when we receive a complaint, when things are not going well, when our numbers are changing or we're not meeting the client groups that we're hoping to meet? Practices are whether or not we share that consistently and regularly, the data that we're receiving. Is there a feedback loop that tells our clinicians and our clients and our patients, family advisors, what it is we're actually doing? What sort of outputs are we getting? What are our outcomes? What are the things that we can feel good about? And what are the things that we need to be able to make some improvements on? And do our staff know how to interpret the data or understand what we're talking about? The products are whether or not the data and reports are accurate, and are they standardized, and are we collecting them in a standardized way? And the last is the people. And this is always a challenge in our sector, is do we have sufficient person resources to be able to both collect, enter, and analyze that data? So there's 3 different sets of skills there. Do we have that in one person? Do we have it in a couple of people? And can we rely on the data that we're hearing and the reports that we're running about how our services and what we're providing to our clients are going? Next one. So for us, where we see the quality and data culture being most important is that upper right-hand side top box, performance measurement and quality improvement and continuous learning, which is part of the OHT context. So it is a factor that's important. It will be part of our work going forward, and those that are involved or aspiring to be involved in Ontario Health teams, it's something important for you to be thinking about. The next one. So this is a part of a tool that the Canadian Mental Health Association has developed, which is a bit of a way of assessing yourself. And we have a number of tools and some webinars that are going to be coming up that can help you to sort of do a bit of a report card on your agency, what your strengths are, and areas that you might want to work on to get yourself into a place where you're feeling confident about your ability to do quality improvement and to measure your outcomes. So this is a bit of a OHT self-assessment criteria on the far left-hand side, the skill set required to meet the criteria, and the supports for meeting that skill set. So ultimately, we would like to be able to submit a quality improvement plan, to be regularly doing that annually, to know what it is we're working on, and to be able to articulate to others where our strengths are, what our areas of improvement are, and what we're actually doing about that. So if you need access to this report, certainly let us know about that, or this document to help do an assessment of yourself. Next one.
It's Mike here. I was just going to add one comment to what Debbie said, because I think this is a really important piece for us to think about. The tool that Debbie mentioned, really, for those who maybe are not part of the current way of doing a full application for OHTs, it would be very helpful to reflect perhaps on those components of a successful OHT application, and Debbie listed those here in the puzzle pieces. And what this tool does, as Debbie said, it really helps kind of pull that out in a way that can provide some very concrete questions for you as an organization to ask and to look at yourself through that lens, and then plan to maybe take action on or to access resources regarding to help position yourself in the best possible way for that next round of OHT applications. So it can really be a helpful thing to think about, sort of planning. As we know, there's going to be more opportunities to be part of an OHT if you're not already going through the full application.
Thanks, Mike. So a series of questions to invite yourself to think about or to ask as you're, depending where you are you invited to do a proposal, are you in development, or are you in discovery? Ways of helping you get ready to be a part of an OHT. So have you had some experience with measurement and the model for improvement? And I'll show you that in just a moment. And what's the capacity within your organization? What again are your strengths? What are areas that you might want to work on? If you're in a recruitment piece or have some opportunity to bring in some new skills, what kind of skills are you looking for that you could make part of your organization? Are you committed to building a system with internal training and accountability, understanding data? And is your board in support of that as well? And has your organization had experience in developing a quality improvement plan? That's not required of our sector at this point in time, but a number of agencies have done that as part of their accreditation process. And does your organization have experience searching for or looking at peer-reviewed articles, gray literature, connecting with others about what it is their experiences are or what they're doing about common issues like wait times, like transitions, like discharge planning, like clients feeling that they're involved in their care planning? And there's a number of resources that are available. HQO has documentations around how to do a quality improvement plan, operational plans, and then E-QIP, specifically the group that are presenting to you today, have done quality improvement projects and initiatives. We have information on our website, and we will be going into some coaching, quality improvement and data coaching coming up in the fall. So we'd be happy to hear from you about that. Next one. And I'll just start this piece, and then I'm going to let Michael finish. So, Mike, if you want to go to the next one. So these are for you to have a look at and to get back to us if you'd like some more information. But the Excellence of Quality Improvement Program, our intention is to increase the capability and capacity of mental health and addiction agencies to do quality improvement and to have that a part of your everyday breath that you take when you're at work. So it's involving these areas. It's having your skill set being available, your teams being available, and striving for both mental health and addiction wellness for all Ontarians. So so that's just about our project, and as I say, we will have some information coming out more in the fall, and I've got information on our newsletter so you can stay in touch. Next one. We would look at, and again, I'm not going to go through these in a lot of detail, but one of the things we help people to do is to identify their quality improvement readiness. And this is just a tool that helps you to think about yourself from a report card sort of perspective or self-appraisal. Where am I or our agency in terms of our quality improvement? And if you're in exploration or installation or implementation, it may be appropriate for you to be connecting with the E-QIP project in the fall to begin to think about how you can enhance those skills and work with some of our coaches to assist your agency to work on a project that matters to you about perception of care with the clients that you're serving. Next one. We'll carry on, and I'll leave those for people to have a read through. The next one. This is what I wanted to show you just briefly. This is about the model that we use to assist people to do quality improvement. And the first piece is identifying what your real problem is. And that's always a challenging piece. We have a number of tools that help to do that. You then want to understand what the problem is. And that's where we're getting to the root cause. We use a variety of different diagnostic tools that we refer to that help us to really understand what we're trying to accomplish. What problem are we trying to solve? The next is how will we know that the change has actually happened, and that's how we understand our data and how we're going to measure our outcomes and our process indicators. And then the last piece is sort of checking out or making those changes, coming up with some creative ways of doing that. And we invite people to think differently than they would normally do in a non-linear kind of way, in some very creative and fun ways about how we might make a difference to solve this problem. And then, of course, you test it, see whether or not you've made some changes. And when we start to see that the change is the right one, it's leading to what we want, then we need to sustain and brag about our accomplishments. So a fabulous tool, internationally recognized. Part of what we've been adding to this process is what we refer to as evidence-based co-design. And it's a way of really hearing accurately the client and family members' perspective on the problem that you're trying to solve. So a really excellent tool that our team are well versed in, that helps us to hear the client voice and involve them in helping to figure out how we make this better. And then, Mike, I might hand it over to you just to finish off sort of the readiness pieces just quickly, and then we'll hopefully have some time for questions.
Great, thanks, Debbie. So Debbie talked a lot about the coaching and the support that's available through E-QIP, and you know, I won't go into too much detail about it, but I will say you'll notice that there's these factors on the screen right now, you know, around accessing information, engaged leadership, but these are really the key ingredients that support successful quality improvement and a culture of quality improvement within an organization or a network. And this isn't because Mike Dunn says so, but this is actually a lot of research that was done by Ross Baker and others out of the University of Toronto. And you can notice that if you look at these factors, that it overlaps quite a bit with those factors on the OHT self-assessment that support folks being successful. So just making that connection in terms of how the coaching and resource offerings through E-QIP might actually be a benefit to you if you're looking again at that OHT end state and wanting to develop your readiness there. We're available to support you. A number of tools, again, that you can take back and maybe test out in your own environment. This is one around looking at those quality improvement factors for success and sort of setting yourself up for sustainability. So if we're changing something, whether it's at a local level or at a program level or redesigning a local system, we can look at some of those factors that will help ensure that that is a successful transformation or a change. And we can use that to try and help us determine where we want to put our energy to maximize our success at being sustainable over the long term. We also have a data culture and an infrastructure self-assessment questionnaire that Debbie spoke about quite at length, which you can use again to look at your own organization and your ability and capacity to capture the data that you want and hope to capture, and then to use that data in a way that's effective for you. So you can ask yourself some questions and do some reflection on that using that tool. Some other helpful resources for you. E-QIP actually did a quick QI webinar series and recorded a series of very brief webinars focused on the model for improvement in the various QI tools, sort of being very pragmatic and practical about it, and anybody can access those at the link that's provided here. We also do have a full YouTube channel with some really a library of resources around quality improvement and all things related to QI and data. Some that may be particular of interest are highlighted there with stars, you know, around governance and leadership and engaging clients and families. Again, themes that are reflected in the current OHT communications and application process. We also have webinars and newsletters that you can sign up for. These are some of the ones that are coming up here in terms of our webinars. We're going to be looking at data culture assessment and really how to do that, as well as quality improvement readiness assessment. So how to really take those lenses to your organization or your local system and pinpoint those areas where some support or resources or time, energy might be well spent. We also offer across the province the Foundations of Quality Improvement program, which is with our partners at U of T and HQO, and developed as the IDEAS curriculum, which harmonizes the quality improvement dialogue across disciplines and sectors within the larger healthcare sector. So really a foundational QI learning opportunity. So you can check that out. You can access our newsletter and keep up to date on all the exciting things in E-QIP, QI, and data by going to this URL and join our community of practice as well. Gosh, we've got lots of stuff going on, so exciting time to be part of the QI world. There's also some webinars that I think Michael or Lynette referenced them through Community Health Ontario And there's a couple that are coming up, one on August 27th, which is the Path to Ontario Health Team. So looking at some case studies in Ontario, and you can visit that. There's also the Path to Ontario Health Teams making the possible in, oh, I can't pronounce that, but somewhere in Colombia. Bogota. Michael tells me it's Bogota. Thank you. So, you really get some examples and some concrete stuff that can help you in your OHT journey. There's also some great offerings through CCIM, the folks who do the OCAN for us, if you're using the OCAN. And they're offering a lot of additional support currently around the implementation and the use of OCAN and OCAN reports, the data that really tells that story through an OCAN lens and can be very helpful if you're trying to look at the needs and demographics of the clients that you serve. There's also some work being planned and delivered through Health Quality Ontario that you can check out as well, related specifically to quality and health, quality improvement plans, as well as the quality standards for mental health and addictions care, and some e-learning opportunities. And I'm whipping through these super fast, but the PDF version that's in the handout section of your control panel will have these links and details. The Center for Care Innovation is also offering some important learning opportunities as well. And with all of that said, and myself out of breath, we'd really like to turn it over to you for any questions that you've had either now or during this webinar that our panelists can answer. So I'm going to go to the question box, and we did have a couple during Michael's presentation. The first question that was asked, Michael, was when you were speaking about the mental health and addictions strategy. Is the province conducting consultations now on the actual strategy? And the person said that they just heard that those ended in July.
Yeah, so just to be clear, so there were kind of province-wide consultations that were earlier in the summer, which I think this individual is referring to. And yes, those were kind of going around to folks around Ontario and getting feedback on the strategy. But there is ongoing consultation, especially at the association level, on the strategy, and we're continuing to work closely with the ministry in those details. So hopefully that's a bit clearer.
Great, thanks, Michael. The second question that we received during the presentation is, this government has cutbacks planned for the pain clinics. How do you think that is going to affect ability of our health team for mental health and addictions to service our population and our proposed for keeping budgets low yet quality of care high? That's certainly outside of my wheelhouse, so I'll flip to my fellow panelists.
So a bit outside of mine as well, but I would just say, obviously the evidence shows the link between kind of pain management and potential mental health and addictions issues down the line. So pain management is a critical component. I think broader terms, not necessarily directly addressing the cutbacks, because I'm not too familiar with those in the pain management world, but I think having a common vision in an Ontario health team is really important. So trying to focus on holistically, how can we provide the best care for clients and patients, regardless of the sector that it's coming from. So certainly, would love to learn more about this, and perhaps I can connect with the individual offline. But holistic care is going to be most important moving forward. So hopefully that partially addresses the question.
Yeah, no, I would agree with that. I mean, it's something, this is Lynette, it's something that we've heard as well, and we've been scheduling meetings with the ministry to understand exactly what is behind these cutbacks, and if there's going to be redirection of those resources, where they're going to be redirected to, just to get some more answers. So we do understand this is a challenge, and we will continue to advocate. And like we said, if you would like to connect with us as well, we'd like to get specific examples of exactly what the impact could look like, because some of those could support our advocacy as well.
Great, thanks, Michael and Lynette. Are there any other questions from folks that you'd like us to try and answer for you? And while we're waiting for any final questions, recognizing it is 1 o'clock now, feel free to reach out to us anytime. My information is there, as well as Debbie's and our two E-QIP program managers. And I know Michael and Lynette as well are both very accessible and would be happy to chat with you anytime about this topic. Okay, I'm not seeing any other questions here. Finally, we'll just remind you to please, oh, there was one that stuck in. Judith, we got your question. Not great, right before the line there. The question is the government working on a system template for OHTs?
A system template. So would that, I imagine that means in terms of supporting people filling out applications, or?
Yes, I'm not 100% sure. Maybe you can provide a bit of additional clarity in the chat box. If you talk, yeah, I don't know if that supports. Certainly, Lynette spoke to some supports for the actual application. I wonder if this is getting at a template around governance or something like that.
Yeah.
Certainly, there are different models that are out there that I think some of our resources address and will be addressing. But no, there's not one template around partners that should be included in an OHT or the governance structure that should be taken.
So Judith has just added additional clarity for best practices on how the models will work.
So for this, what I would strongly recommend is, like I said in one of the slides, is they're going to have in-person meetings or webcasts where they will be speaking to what this OHT process should look like going forward and what the expectations are. And I would strongly encourage you to either attend the webcast or the in-person meetings where that information will be available. As well, anything that they'll be sharing will be available on the RISE website.
So that, yeah, that's what I was going to direct to as well, Lynette. So that RISE resource, which is on the resources page that Lynette spoke to, is going to be critical for OHT to OHT learning. So learning which models work best, and that's going to be a really important resource relating to this question.
Great. And Mary, we did see that you'd like to connect afterwards, and absolutely we'll make sure that that happens for you. We did have one more question, and given that we're over time, we'll take time to answer it. Though I'm curious to know what the involvement has been in the whole process from the Indigenous, provincial, territorial organizations like the Union of Ontario Indians. I don't know if either of you have any insight into that.
So we've brought that question, and what we've heard is there's been extensive engagements with who needs to be involved. At this point, we're not quite clear because the ministry hasn't really released a list in terms of exactly who they spoke to and when. So in terms of what the details are, we really can't speak to that, but I'm sure when you pose the question to them, it has happened. Just in the fashion is something that we're not quite clear on.
And hopefully that's something that organizations like ours can continue to push for some clarity and more detail on, I think. Well, thank you very much again to our panelists and to all of you who participated today. And please do reach out anytime if you have any additional questions, comments. If you're interested in any of the offerings or supports that have been talked about today, we'd be very interested in connecting with you and chatting about this stuff further. So thank you very, very much.
Thanks, everyone.